for my session, some of the key points that I'd like for attendees to take away would really be this is the first step is a reflection of understanding what are your current practices? How do you lead by example when it comes to work-life balance? Being a transformational leader means that you're embodying your own behaviors and being self-aware of those behaviors. And so until we sit there and acknowledge what behaviors are unhealthy in our own practice, then how can we expect others to model that, especially when we're mentoring them and having succession planning? It is very difficult to fill a lot of these leadership roles right now. And I think part of that is because staff see what that means, what that title entails, that you are working 5 days a week, that you are working 10 plus hours, that you have coverage on the weekends, that you are taking calls well into your evening. And they see that and they do not want that. And so it's how do we switch that mindset to make this more encompassing and to succession plan appropriately by changing our own behaviors and changing what that means to be a nurse leader right now. So that's really the focus, is reflecting on your own practice and how can you make little changes and little adjustments in your own workflow that meet your own demands. We can only give so much of ourselves if we don't fill our own cup first. That nurse leaders can take right off the bat to promote work-life balance would really be, again, setting clear boundaries and expectations. So when I'm taking a day off, I make it very clear to my staff members that this is the day. For example, when I go to Expo next week, I will be off site on the following days. I will have very limited access to my cell phone. Here is the person that will be covering me for this day for immediate concerns, right? So giving staff enough time to know you will not be at your desk, you will not be readily available, but here is the person that you can in fact reach out to should you need that urgent need, right? Another thing too, as I kind of have stated before, it's okay to use those work off IDs if your organization allows it. If you have enough coverage and enough people to be here to support the clinical staff, then there are some days that we do have very much administrative tasks that need to be performed, creating presentations, responding back to emails, all of those items that if you work from home, it can give you a second to, maybe you don't have to get up 2 hours early to drive into a city or commute to your job. That really gives you a little bit of extra time for yourself in the morning and a little bit more flexibility as well. And again, I think it's setting very much your own personal limitations on how often you're checking your work phone, checking your work email, having those distractions, really setting time. If you only check it once a day when you're on vacation, if you truly feel like you can't disconnect, but make sure you stick by that limit that you give yourself, unless it's something completely urgent that needs to be addressed or cannot wait until you come back into the office. So if there was a paragraph that I could say that sums up all the points of this presentation, it really is to provide yourself a little bit of self-awareness and reflective practice as being a nurse leader. I really believe that until you acknowledge whether or not you are following the rules that we want in promoting work-life balance, we cannot instill this on others or expect others to mirror this behavior until we make that change. And I really believe that we need to have the acceptance that it's okay to take a break. It's okay to fill that cup back up again once it's depleted and empty. Someone told me when I was early on in my career that, you'll miss taking care of patients. That will be something you're removed from the bedside, but your nurses really become your patients, and seeing them happy and succeeding is a lot, but it takes a lot of work and effort. So we need to be the best that we can be as nurse leaders, in promoting our own health and wellness and work-life balance to be the best for our staff